It'd be a nightmare for any parent. You trust the daycare you're sending your kids to keep your kids healthy, but instead the food they're fed lands them on dialysis in the ICU. The story of the E. coli outbreak in Calgary grabbed the attention of parents across the country, so we talked to ER doc Shazma Mithani.
So this is a very specific strain of E. coli called Shiga toxin-producing E. coli. And the unique thing about this type of E. coli is that it produces this specific toxin, and that's what causes severe disease. So this type of E. coli can be found typically spread by foodborne illness. So kind of undercooked beef, produce, unpasteurized milks and juices. And so what can happen is when this bacteria infects your gastrointestinal tract, this toxin gets produced, and the toxin is the issue. It basically can produce this severe syndrome called hemolytic uremic syndrome, which causes multiple little blood clots in the small blood vessels in your body, and that includes the kidneys. And that's why we're hearing about these young children that are on dialysis, because their kidneys are affected from this toxin that this specific type of E. coli produces. And so in most people, the symptoms that you can expect are similar to any sort of like stomach flu, we call it, right? And so the diarrhea, vomiting, abdominal pain, and sometimes a fever. If it's going to be a more severe case, and in particular with this type of E. coli, one of the red flags that we kind of ask parents to look for is if there is bloody diarrhea. So anytime there's bloody diarrhea, that's an important reason to go see a doctor. If there's severe abdominal pain, if there are concerns about dehydration, and if there's a persistent high fever, or of course, if your child is unwell, Ryan, you talked about how that mom just kind of knew that something was wrong.
Yeah.
If there's something that doesn't feel right, those are all reasons to go in. But like a lot of the symptoms are very similar to other gastrointestinal illnesses, but can be more severe. And then that hemolytic uremic syndrome is another complication of this type of E. coli that is even kind of a much more severe complication that can land people in hospital. So the interesting thing about hemolytic uremic syndrome is that it actually disproportionately affects young kids. So up to 20% of children who have this particular strain of E. coli can develop this hemolytic uremic syndrome, and then a smaller percent of those will end up needing dialysis. Now, when it comes to kind of the specific recovery of the kidney disease or the kidney injury, we call it, that happens from HUS, about 2/3 will completely regain function of their kidneys back to normal. And then about 1/3 may have some kind of mild to moderate lasting kidney disease kind of going into adolescence and adulthood as well. So it's certainly a concerning phenomenon that we're seeing here.
Every single restaurant you go to, you trust they're doing the right thing. Every hotel you stay in, you trust they're doing the right thing. You would think that daycares would be held to an even higher standard, but it turns out that this is a repeat offender that we're talking about. I mean, this is a breach of trust, plain and simple. That's how I see it. I don't know about you.
Yeah, absolutely. Just like you said, Ryan, I mean, every time we go to any public institution, there are kind of guidelines and laws and kind of parameters that are supposed to be followed. And we as citizens, we place trust in all of these places that we kind of patron. And yeah, this is definitely a breach of trust. And I'm sure it's going to be really challenging for the parents involved to be able to overcome that going forward.